This is the Emergency Medical Minute, sponsored by Mile High Ambulance.
I think it's pretty safe to say that one of the more common kind of uses of medications in the ED is just to treat nausea. And we have several choices for it, but there's not a lot of good studies to really say which one is better than others. There was an interesting little trial that looked at two of our favorites recently, Zofran versus Droperidol, in a randomized trial to see which one had better control of nausea, side effects. And they used pretty big doses. They used 8 milligrams of Zofran versus 2.5 milligrams of Droperidol, very decent doses. And they basically looked to see who had better control of their nausea, and overall it was pretty similar with a trend towards Droperidol having better control of nausea. Patients said that Droperidol met their expectations better, and patients with Droperidol needed less rescue medications, which is nice, but kind of not surprisingly on the flip side, patients who got Droperidol were way more drowsy or had light sedation. Unfortunately, the trial didn't look at kind of who was in the ED longer. That would be very nice to know is, if you get Droperidol, does your nausea go away faster, but then you're zonked for 2 hours, 3 hours. So I didn't say that, but I'd say Zofran's still a very reasonable, effective first line for most people. But then Droperidol obviously is very effective, kind of if somebody needs more medications and they might get a little sedated, which sometimes is not a bad thing. Any questions or comments? Thanks, guys.
We'd like to thank our sponsor, Health One Continental Division, and Swedish Medical Center for their financial contributions to the EMM. Donations from them and listeners like you make it possible for us to fulfill our mission of producing and spreading free medical education to the masses. If you enjoy our show, please consider making a one-time or recurring donation to help cover our operational costs and keep the EMM awesome. Click on the link in our show notes to make a donation. Thank you for listening.